Hello, I'm Dr. Dewhurst from Macon County Public Health as the medical director. And we want you to know that Macon County Public Health has been preparing for COVID-19 response for some time. And all of our staff are working diligently to mobilize all of the resources that are available to us so that we can do our best to mitigate the spread of COVID-19 in and around our area of Macon County and surrounding. So we would like to encourage you not to panic because we have been at this for some time. If you believe that you may be symptomatic, we do want you to call ahead to your doctor or the health department to get further advice regarding whether to come in and be seen and possibly tested. We have a call center open, and the phone number for that is 828-349-2517. And that's if you have questions or you need some further advice to know what the next steps are. So we've been following the recommendations from the CDC and also from the North Carolina Department of Health and Human Services. And those recommendations for everybody include washing your hands frequently with soap and water for at least 20 seconds, or using alcohol hand sanitizer that contains at least 60% alcohol. Avoid touching your face. Practice social distancing, even if you are well. But if you are feeling sick, the first thing is to stay home. Do not go to work. Call ahead if you feel like you really may need some medical care for some further advice. Thankfully, not every case of COVID-19 is severe. Most of them are mild to moderate. And the ones that we will be focusing on primarily are those that are in the more severe high-risk groups and the ones with the most symptoms. So those large groups certainly include those that are 65 years of age and over, and folks with pre-existing medical conditions or who are immunocompromised. So far, we have tested 36 people, and we have received 7 negative results, and we're waiting on the remaining tests. We have no results yet reported. The criteria for testing includes fever or signs or symptoms of lower respiratory illness, including cough and shortness of breath, in any person, including healthcare workers, who have had close contact with a laboratory-confirmed case of COVID-19 within 14 days of the onset of their symptoms. Another criteria is those with fever and symptoms of lower respiratory illness and a negative flu test and no more other likely diagnosis. Those, again, are the ones that we're going to be primarily focusing on, along with those in the high-risk groups. Again, we'd like to stress that this is not a time for panic, but that we are working diligently to help prevent the spread and as well as to identify disease in those that are at risk.